Can drug-resistant TB be transmitted to others? Imagine a tiny bacteria that can cause serious lung disease and has the ability to resist many medicines. That bacteria is tuberculosis, and when it becomes resistant to drugs, it is called drug-resistant tuberculosis. But the big question is, can this resistance spread from person to person? The answer is yes. Drug-resistant tuberculosis can be transmitted just like regular tuberculosis. When someone with active TB disease in the lungs or throat coughs, speaks, or sings, they releases tiny droplets into the air. These droplets contain the bacteria, including the resistant strains. If someone nearby inhales these droplets, they can become infected. This is why TB spreads through the air and not through touch or surfaces. Drug-resistant TB develops in two main ways. One is called primary resistance, which happens when a person gets infected directly with bacteria that are already resistant to medicines. The other is secondary or acquired resistance, which occurs when someone with TB does not complete their treatment properly, allowing the bacteria to adapt and become resistant. This makes controlling the disease more complicated because resistant bacteria can spread in communities, especially if diagnosis and treatment are delayed. The risk of transmitting drug-resistant TB is higher in places with poor ventilation, close contact, or where people spend a lot of time together, like crowded homes or clinics. Early detection and proper treatment are essential to prevent the spread. When TB is diagnosed quickly and treated effectively, the chances of passing resistant bacteria to others decrease significantly. Public health efforts focus on identifying resistant strains early, ensuring patients complete their treatment, and reducing exposure in high-risk environments. In summary, drug-resistant tuberculosis is indeed contagious and spreads through the air, just like regular TB. It can be transmitted from one person to another through inhaling infected droplets. Preventing its spread involves early diagnosis, appropriate treatment, and good infection control practices. Always consult healthcare professionals for diagnosis and treatment options, and stay informed through trusted health sources. This approach helps protect both individuals and communities from the serious impacts of resistant TB.